everyone, my name is Seungman Cha. I'm an assistant professor of Graduate School of Global Development and Entrepreneurship of Handong Global University. Today, we are going to learn about how South Korea has responded to coronavirus or COVID-19. South Korea has turned from a COVID-19 hot zone to a leader in the global fight against the new coronavirus. And South Korea is reported to be running a textbook response to COVID-19. Today, I want to report on how South Korea worked together to get this far. So the main aim of today's lecture is to contribute to preventing a resurgence of the virus in many parts of the world by sharing South Korea's recent experiences. Many countries around the world have shut down to curb the spread of the coronavirus, but in South Korea, people are starting to come back out on the streets. Starting in late February, South Korea was reporting a sharp increase in coronavirus cases. With over 5,000 infected, they were registering some of the highest numbers of confirmed cases in the world. Then something changed. While cases in most other countries continued to rise, South Korea's numbers started leveling off. According to the latest updates by Korea CDC, 10,752 have tested positive and 244 have died, for a death rate of just over 2%, less than half that of the US. It indicates that Korea managed to contain the spread of the coronavirus early on, and they were able to do it because they had learned a valuable lesson a few years ago when they fought a different coronavirus outbreak. In 2015, a Korean businessman returning from the Middle East developed a fever, cough, and eventually pneumonia. He went to several health facilities for a diagnosis before finally testing positive for MERS, Middle Eastern Respiratory Syndrome. By that point, his movement had created a chain of transmission that became hard for officials to trace. They didn't know who was infected or where they had been. Altogether, the virus infected 186 people and killed 38 in South Korea, the highest of anywhere outside the Middle Eastern areas. South Korea got a lot of lessons learned, such as the importance of diagnostic tests and basic infection prevention measures. The lessons all came into play when the next outbreak took hold in the country. Let's talk about how South Korea did respond to the outbreak of COVID-19. And also how Korea successfully managed to control the virus. First, testing. South Korea has tested much higher proportion of people compared to other countries at the early stage of coronavirus outbreak by pioneering different ways of testing. Let me explain why testing substantial proportion of people were made possible here in Korea. Some companies jumped into action, researching test kits in their laboratories in January, when they heard about the first coronavirus death in Wuhan. South Korea learned the importance of early diagnosis during the 2015 outbreak of MERS. The key lesson was that the faster you test, the faster you are able to isolate infected people and stem the spread of the virus. The government worked with companies this year to produce test kits so they could quickly receive regulatory approval to test Koreans. With no shortage of kits here, South Korea companies are now exporting millions of virus test kits all over the world. Emergency use authorization was put into place in 2016. The situation during the MERS virus outbreak was similar to what South Korea has now, and we instituted a system. Normally, the authorizing agency needs 80 days to go through the legal process of approving products, which requires clinical trials. With emergency use authorization, the process time can be reduced to between 2 and 3 weeks. The number of tests our health professionals conduct is tremendous, even by global standards, yet their determinations are 98% to 99% accurate. That means you can rely on them. South Korea has designated testing centers. If you are feeling symptoms, you go to the testing centers and a medical professional will look at you. If he or she feels that your symptoms match that of the virus, then you get the testing done free of charge. If you are not showing any symptoms related to the virus, but you still want to get tested, then you can pay your own way. So it's not 100% free, but it is fairly easily available. The Public Health Center is a local medical institution established at every administrative level, city, county, and district. You can consider them as being on the front lines in the efforts to prevent an outbreak of an infectious disease, as well as block its spread once an outbreak occurs. Every public health center in South Korea operates a triage room. They perform epidemiological investigations on confirmed cases, and they oversee epidemic control and disinfection work within their respective localities. The triage room, as the name implies, is for treating those suspected of contracting COVID-19, unlike the examination and treatment rooms at regular medical institutions. If you visit a triage room and health professionals determine you need an examination, they take throat and nasal swabs and collect the phlegm sample. Then you go directly home, isolate yourself, and wait for the test result to come out. These results normally are ready in 6 or 7 hours. South Korea created so-called drive-through testing facilities. The triage rooms require at least 30 minutes to test one person at the drive-through testing site. The document receipt, oral interview, sample collection, and disinfecting work takes around 10 minutes to complete on average. The conventional approach requires the medical staff to change their protective clothing after each test. At the drive-through site, the visitor simply lowers the automobile window a little to talk with a medical professional and collect the samples. Thus, contact between the visitor and the tester is minimized, which greatly lowers the risks of contagion in the course of testing. We can diagnose a lot of people in a short period of time, so we can effectively control the coronavirus. And then secondly, we can minimize the infection. The testing methods currently being employed is called reverse transcription polymerase chain reaction, RT-PCR, which examines genetic material. Scientists amplify a specific part of the DNA unique to the COVID-19 virus, and if an abnormal level of fluorescence is detected, the sample tests positive, otherwise it is negative. At present, the testing laboratories countrywide have the combined capacity to conduct between 10,000 and over 20,000 RT-PCR tests per day. This work is worthwhile because when cases are confirmed early, the fatality rate drops. The second component which we want to emphasize for an effective control of COVID-19 is trace, or tracing the infected people. If South Korea finds somebody who turned out to be infected, then they backtrace these people's movements. Various district offices will send out text messages with the dates and the places infected people have been to. If you find yourself having been to these places around the same time as the infected people, you are advised to come to the authority and get tested. Let me explain the details on the tracing strategy. China reported the first case of coronavirus infection in late December last year in Wuhan. In the following weeks, as the outbreak started spreading across the world, South Korea only had 30 confirmed cases of the virus. But despite the low numbers, health authorities had already started working with biotech companies to develop a test for the novel coronavirus, and soon they had thousands of test kits ready to go. They prepared for the worst, and the worst quickly followed. By late February, the total number of coronavirus cases rose dramatically, surpassing 3,000 in Korea. This made South Korea's outbreak the largest outside of mainland China at that time. After a while, a woman went to the hospital with a fever. Because the government had already equipped hospitals with coronavirus tests, doctors were able to test her. She tested positive and became known as patient number 31. But the testing didn't stop there. While she was sick, she had gone to a mega cult church where she sat with a congregation of hundreds for more than an hour. So they traced her movements, identified people she had come into contact with, and then tested those people as well, whether they showed symptoms or not. Many of them also tested positive, so they were quickly isolated and treated at home or at a center. And then all the people they had been in contact with were traced and tested too. This is called contact tracing. It's an approach that allowed Korea to test over 9,000 people who had been in contact with someone who had tested positive. After the surge following the patient number 31, Korea ramped up testing around the country. Private and national healthcare systems joined forces to set up a mostly free testing effort. That includes more than 118 locations that screen as many as 20,000 people per day. Through the system, when anyone tests positive, the government is able to test and trace their contacts to continue to break the transmission chains of the coronavirus on a large scale. But that's just the human-to-human transmission. The infected person may have moved through the city, touching subway poles and door handles, and South Korea had prepared for this too. After the MERS outbreak, when they weren't able to trace the movements of the virus, Korea changed the law, allowing the government to collect the patient data and security footage during an outbreak. All their steps are logged and then shared to alert people to stay away from the path of infection. Websites and private apps compile the information, allowing everyone to see if a person with a confirmed cases of coronavirus went to a pharmacy or the hospital or anywhere else. And they will know how recently they went to. It's a means of checking the possibility of infection. Citizens are checking the coronavirus locations and are avoiding going to these areas. This information lets people know if they crossed paths with an infected person so they can go get tested for the virus. And contact tracing starts all over again. Tracing people's every move can be controversial, but many in South Korea prioritize public health over privacy in an outbreak, which means public interests tend to be emphasized more than human rights. As a result, South Korea was able to test hundreds of thousands of people, more than any other country at the time. And this made it easier for authorities to trace the virus to see where it is located and where it may be lurking. This ability to find and treat infected people has allowed South Korea to avoid aggressive lockdowns, and it helped bend the curve of the outbreak that started out dangerously steep. For now, South Korea has turned the corner, but they continue to be prepared. It's the kind of vigilance that has set South Korea apart in the coronavirus pandemic. Korea's strategy of contact tracing might not be easy to replicate in other countries, particularly with much larger populations. but the country's success with widespread testing still offers a way out for most countries that are stuck in lockdowns. Unlike many other countries, South Korea has not sealed off the country, except for a few countries. Instead, Korea developed special entry procedures. Everyone, regardless of the point of departure, who wants to enter South Korea is subject to this system. In light of the increasing number of COVID-19 patients and confirmed cases among incoming arrivals, the Korean government imposed a mandatory 14-day quarantine on all passengers arriving from all parts of the world from April the 1st. In addition, beginning on April 13, all inbound passengers arriving from the US, either Korean nationals and long-term foreigners, are placed under self-quarantine and must get diagnostic tests within 3 days from isolation. All entrants from abroad, both Korean nationals and foreigners, will go through a diagnostic test. If they have fever or respiratory symptom identified during the quarantine stage, passengers who test positive for COVID-19 will be transferred to a hospital or living and treatment center. Korean national or long-term foreign nationals who test negative will be placed under self-quarantine for 14 days, and foreign nationals who are short-term will be placed under quarantine at facilities for 14 days. The special procedures continue with monitoring after entry, and the entrants are guided to triage rooms and other facilities so that they can be tested for the virus. They are required to install a self-diagnosis application on their phone. This allows them to stay informed of their status. They are checked daily to determine whether they have developed a fever, cough, sore throat, or other symptoms. All of this has been made possible because the quarantine stations and quarantine management teams at the Korea CDC and the monitoring support team at the Central Disaster Management Headquarters, local government, and other relevant organizations are all working closely together. They monitor whether foreign nationals who enter Korea have downloaded the self-diagnosis application and whether they are showing any symptoms of the COVID-19 infection. When they have symptoms, they make sure they call 1339, which is the call center, and get the necessary instructions on what to do. When persons who have installed the app do not use it, they call them daily by phone for 14 days to confirm their status. So the 1339 call center, they answer callers' questions and provide them with information and guidelines on the ways to deal with medical institutions or public health centers. They communicate through messengers with those residents who have difficulty in contacting the call center by phone, and they provide consulting services via messengers to the countrymen overseas as well. When people call the center, they first confirm certain details and make their determination based on that information. Then they tell the callers which treatment center they need to visit or whether they should go to a safe hospital instead. They were handling some 850 inquiries around the time when the first COVID-19 was confirmed. As the number of confirmed cases continued to grow, the number of daily inquiries skyrocketed to around 70,000. The Korea government designated some hospital wards as the National Isolation Unit to be kept on standby. For receiving patients infected with a contagious disease, that wards are ready to respond immediately to an outbreak. They are equipped with negative pressure systems and staffed by well-trained professionals. The central government oversees the National Designated Isolation Unit and provides financial support for their upkeep. Maintaining negative pressure units is essential for preventing the virus from escaping the room. Well-trained healthcare workers are also needed. South Korea designated also residential treatment centers to provide support to persons who will naturally recover or will recover with symptomatic treatment alone. The facility admits patients with mild or no symptoms. This way, those patients who require intensive care can have priority access to the specialized hospital. The government also designated safe hospitals across the country. The safe hospital separates the wards, and movement between different wards is restricted. This arrangement obstructs contagion between general outpatients and patients with respiratory disease symptoms. People are separated at the main entrance based on their medical issues, with some going to the safe ward and others sent to the triage room. The Korean government set up a personnel management team for controlling COVID-19. Their job is to support medical professionals. For instance, they locate nurse, nursing assistants, and other qualified personnel or residential treatment centers by region, and dispatch the people to where they are needed at any given time. The very limited pool of human resources who can work in support of public hospitals was a source of distress for them in the personnel management team. They thus aimed to change the situation by recruiting people from the private sector. Therefore, they posted an advertisement for hiring on the Ministry of Health homepage. Many people applied with a strong sense of duty, reducing the number of patients who lack access to healthcare providers. Patient Management Task Force comprised of healthcare providers in each city or province. They classified patients who have tested positive by disease severity into mild, moderate, severe, or critical. Patients classified as moderate and above are immediately transferred for in-hospital treatment, having negative pressure isolation rooms or infectious disease hospital. Patients with mild COVID-19 infections, they are the patients who need to be quarantined to prevent transmission and being monitored, but rarely require in-hospital care. They are transferred to regional public relief hospitals, staying at government-operated facilities or lodgings. A public relief hospital is designated in each city or province to form medical support network with healthcare facilities in the vicinity. Public relief hospitals have been set up starting in Daegu and Gyeongsang-Buk-do province. Korea government tried to curb mortality rates by swiftly directing medical resources to patients with severe cases of COVID-19 and provide response medical support by protecting patients with mild cases of COVID-19 at public relief hospitals. Healthcare providers make the rounds to check up on patients with COVID-19 staying in public relief hospitals. If symptoms worsen, the patient will immediately be transferred to a healthcare facility. If symptoms improve, the patient will be discharged and sent home in accordance with discharge procedures. Aside from medical treatment, public relief hospitals are tasked with bed and board, medical waste treatment, and disinfection of the premise. South Korea raised COVID-19 alert level to highest as of February 25, 2020. The Korean government has assembled the Central Disaster and Safety Countermeasure Headquarters, headed by the Prime Minister, to bolster government-wide responses to COVID-19. Korea CDC urged citizens to strictly abide by the Code of Conduct and preventive measures set forth in accordance with the serious alert level. Code of Conduct or preventive measures were developed by each group, such as general public, symptomatic persons, seniors aged 65 and above, and residents in COVID-19 affected areas. Let me explain the Code of Conduct by each group. The Code of Conduct explains for symptomatic persons about what to do when experiencing respiratory symptoms such as coughing, sore throat, or etc. They need to refrain from going outside, including schools and workplaces, and they should get plenty of rest and monitor their symptoms for the next 3 to 4 days. People with persisting high-grade fevers of 38 or above Celsius degree are instructed to observe the following: contact the call center or health clinics, or get a checkup at a COVID-19 screening center. We should make sure to drive in our own car and wear a mask when going to healthcare facilities, and inform the medical staff of our overseas travel history and exposure to people with respiratory symptoms. Expectant mothers, seniors ages 65 or above, chronic patients are advised to observe the following: stay away from crowded areas. If we have to leave our home or go to healthcare facilities, we make sure to wear a mask. Residents in COVID-19 affected areas are advised to observe the following: we need to refrain from leaving our house and traveling to other regions. Quarantined persons are instructed to follow the orders of physicians and quarantine authorities. The general public is advised to observe the following: wash our hands thoroughly with soap under running water, cover our mouth and nose with our sleeve when coughing or sneezing. We make sure we need to refrain from touching our eyes, nose, and mouth with unwashed hands, and wear a mask at healthcare facilities. We make sure we avoid crowded places, avoid coming into contact with people displaying symptoms such as fevers and respiratory symptoms. For some people, particularly low-income group, who lack medical care, they were given free face masks at a nearby community center by government or NGOs. For instance, there is an NGO named Korea Pest Control Association. They pay for the supplies and disinfectant out of pocket to give the low-income group of people. Even in Seoul, there are a sort of housing facilities where some people need to share a single kitchen or a bathroom. It's a kind of cage room in Hong Kong. The residents living there have very little money to buy face masks or disinfectant. So some volunteers or government officials disinfect these buildings to keep it safe. So far, these sort of housing facilities were reported outbreaks free. Government enhanced the social distancing campaign, but not forced it. There was no lockdown or even a shelter-in-place order. However, there was a lot of proactive, preventative behavior on the part of ordinary South Korean citizens. Again, there's not been any lockdown in South Korea, but there wasn't anybody on the street when coronavirus surged. South Koreans were told, please stay indoors, because the situation was getting really serious. People decided it would be better to stay indoors. That kind of awareness was the biggest factor in containing the virus spread. Even South Korea voted in a parliamentary election despite the epidemic. People had to take their temperature taken and wear rubber gloves and masks to vote. Lines were marked to keep voters at least 3 feet apart, and quarantined citizens could only leave home for a short time to vote after the polls had first closed for the rest of the public. There was a lot of confusion about masks. Wearing a mask is much better than not wearing one for yourself and for other people. Ordinary South Korean people prefer to get the best masks that you can get. If we need to go out, we go out wearing a mask. If we need to talk to somebody, we keep the mask on and keep the 2-meter rule. If it is absolutely necessary to talk to somebody, we text them instead. we have a single-payer health care that we can trust. That is also another important factor that people are confident of the government efforts to make it possible to control COVID-19. During a health crisis, which can trigger public anxiety, disseminating information quickly and transparently is also part of the quarantine effort. Conveying essential information in detail, such as the outbreak status of an emerging infectious disease and the government response measures and the disease prevention regulations, enables the public to understand the situation and trust what the government is doing. Now, South Korea, we are now approaching the end of the tunnel. We are going to see a drop in the number of cases in South Korea. And we hope, and I hope, you can also see a drop in the rest of the world as well. I believe if everyone follows the basic guidelines which we shared, every country in the world should be able to do this. Thank you very much.